Okay, I guess we are live. Ladies and gentlemen, as promised, Dr. Tony Leachon. Good evening, Tony. Sir, Doc.
Ay, Jiggy, kamusta?
I can't believe it, Doc. It's already October and we are still talking about this. We have been talking to each other for, I don't know, the past 2, 3 times already. It's been months since we last spoke to each other. I remember the last time nag-usap tayo, it was the time when the president told everybody that the Cebuano ay medyo gahig ulo, medyo hard-headed. And he brought in the troops here, and now months after that incident, months after he said that medyo we are hard-headed, Cebu City has managed to reduce our incidence of COVID-19 to single digits. In fact, I got a report from the chief deputy implementer of IATF here in Cebu, Councilor Joel Garganera, that I think we have less than 10. I think we have 8 incidents of positivity here in Cebu City. So we have had quite some sort of success here in Cebu. But like I asked him earlier, actually, Doc, I spoke to Joel a few days ago, and he said that the job is not done yet. Hindi pa tayo tapos, and we're still going to be continue to be vigilant as much as we can in Cebu City. Doc, before we talk about the entire country, I'd like you to talk about Cebu in particular. I know you're aware and familiar with the case here in Cebu from the very beginning. Tell us what happened in Cebu and how do you think we managed to reduce and control COVID-19 to single digits?
Yung Cebu is a unique experience kasi all along kasi there was this particular parang impression that Cebuanos are stubborn, obstinate na ganun. And we saw leaders then at that time na I have a first an experience na hindi naniniwala sa mask, and then social distancing, just basically parang Trump style, no? Parang ganun. Ako naman, reading so many books and experience then, it's basically parang you want to influence social behavior. Mm-hmm. In the book ng Switch, yung when you want to change things when change is hard, yung Hit Brothers identified several mechanisms bakit ganun yun. And then, in-apply natin yan during the time na sa NTF on how to address that. Ang first reason, akala natin, people are ignorant. Hindi pala. It's just that the leaders fail actually to instruct the people on how to do it. Let me give you an example. That's the first principle. Like for example, patigilin ko manigarilyo mga pasyente or mag-diet. Ang question ng pasyente paglabas, wala naman sinabing doktor on paano ko titigil ang paninigarilyo, paano magda-diet. Di nga ako marunong, di nga ako nutritionist eh. Ilang calories yun. So basically, sabihin natin how do you solve a crisis? Eh wala ka naman binibigay na template or blueprint. Yan ang unang tanong ng pasyente. That's why for so many years, I failed as a cardiologist on how to make my patients healthy. In-apply natin yan. Ang second reason, kaya we failed daw, kasi we believe that people are inept. Ibig sabihin, ineptitude, may knowledge pero matigas ang ulo. Mm-hmm. So, hindi totoo yan. Kasi in Singapore, may coercion doon and then naging way of life. So, nangyari dyan sa Cebu, basically, pagdating ni General Simato, hindi IATF, may tangke dyan, may restriction, talagang chinek yan. Okay. Nagkaroon ng reawakening dyan eh. And even the leaders dyan nagbago. For example, si Mayor Edgar Labella, si Governor Gwendolyn, and a lot of public officials. Nakita nila yung hirap eh. Okay, so yan ang number 2 reason. And then the number 3, during that time, walang blueprint na maliwanag eh. Though meron tingin ko, pero hindi siya playbook. Yung kunyari may checklist ka. Let's say, meron ka bang testing? Adequate ba yung contact tracings mo? O may contact tracings ka pero yung amount of testing ba enough para malaman yung magnitude of the sick and healthy? Yan ang isang question eh. Number two, may contact tracings ka. Apparently wala kasi dumating pa yan si Mayor Magalong 2 weeks after eh. Okay. Number three, may isolation facilities ka. Meron, pero walang tao. Eh nalaman natin eventually that ang effective pala niyan, dapat pag positive ka, you have to forcibly bring these positive patients to isolation and quarantine. Those are things na nag-evolve eh. And then, ang Cebuano, step up to the plate. Ang Cebuano naman, ever since, based on history, ano yan eh, fighter yung mga yan eh. Tsaka, ibig sabihin, madali silang turuan. And then the question, maliit ba? Kaya madaling i-control? Hindi. Ang daming maliliit, lalo na sa NCR, ang daming mga LGU maliliit. Hindi yan
Maliliit ang
sa liit o
population,
sa
you mean?
laki. Well, ibig sabihin, it's not the hugeness of the population eh.
Okay.
Because there are countries smaller than us, tapos mababa ang GDP, pero tama ang template. So they just maximize their budget in order to achieve.
But isn't it the density of an area that allows for faster spreading of the virus, Doc?
Sabihin, let's say, per capita, we're about playbook eh. Kasi lahat naman na inaatake ng COVID density yan eh. Let's say Italy. Okay. Mga capital yan eh, mga Rome, mga let's say Madrid, ibig sabihin London, New York. Ang inaatake wala naman eh. Lahat ng sakit inaatake, even non-communicable, is the density. Ang problema diyan is how the leaders and the population will respond to the challenge. Okay. And apparently, nagsalubong eh. Humusay yung leaders, gumading yung yung mga population, and then they just follow the playbook. And then hindi na bumibitaw. I think that's the secret of Cebu. And then matagal din kasi ang inyong ECQ. Nag-ECQ kayo, then MECQ. Ibig sabihin, you were able to sustain that na nag-lockdown. Kaya sa Manila, after the call out ng doctors doon, MECQ, ang igsi lang, 2 weeks lang. So kung nga rin napahaba yun, I think baka this time, hindi lang 2,000 yung cases namin, dapa na yan by this time, mga 1,500. Kasi you have to sustain that particular quarantine period for acute cases and then build up the capacity. It will take about 2 months based on the theory ni Thomas Peyo, yung hammer and dance strategy. Hindi yan kakayanin 2 weeks. Kasi hindi naman magagawa yung mga facilities in 2 weeks or 1 month eh. Particularly kung wala ka investment in healthcare to start with.
So Doc,
these are the things.
We have had some sort of success here in Cebu City. But the question is, of course, that's always looming in the minds of people is that second wave. How do we prevent a second wave from coming? It's already been proven in some parts of the world that, that idea of a second wave did come from the influenza pandemic back in 1912, right? That idea that there is a second wave. It's already been, we've seen it in New Zealand, in some parts of the world, that a second wave did come. Now, the question is, how does Cebu prevent a second wave? How do we continue to slow down the virus?
Okay. Jiggy, tatlo ang reasons niyan. You have to identify yan eh. Hindi mo pwedeng hulaan yan. So based on previous data, yung 1918 pandemic, secondary lack of discipline. So after na maging successful sila sa Philadelphia, nagpabaya sila. In 3 months, 50 million namatay. Mas greater ang mortality. Alinin natin, makokorek ang surge because meron na tayong investment before on healthcare and then meron na tayong nauna na sa Cebu ng healthcare capacity. Na second reason, you have to watch out for the rainy season. Ito yung cause ng mga surge. Pag umulan, dadalhin sa evacuation center, then you will engage, tatabi-tabi na ng pasyente, masisira yung social distancing. Ngayon India, nagkaroon ng typhoon, kaya India ngayon number 2. And then a number three reason pag nag-open ka, Jiggy, ng school. Pag nag-open ka ng school, isa yan sa cause sa South Korea. And then number four, as you reopen the economy din, more people are going out, dun magkaka-surge like in Japan. So if you identify four of these things and apply the previous principles, I think we'll be okay. So kung nasusunod ng Cebu yung playbook, yun pa rin eh. You maintain your mask, your face shield, and your social distancing, and do the testing and the contact tracings, you'll be okay. Kaya yung countries like South Korea, pagkatapos sila ng surge, correct. Singapore, correct. New Zealand, correct. Ibig sabihin, ang dali nila mag-bounce back kasi alam na nila yung gagawin. Because there is a playbook. And the investment on the healthcare capacity, nandun na. Madali siyang reactivate. So that's the secret on how to prevent surges.
So I guess we have been doing this one for the past 8-9 months now. So in a way, we have become sort of hopefully experts. As long as we have learned from what we, all the mistakes we've made in the past, I think we can learn and become very good at curbing and slowing down the virus. Now we are just talking about Cebu City.
There's another observation though.
Yeah.
I don't think it's related. No,
Mm-hmm.
I think the death of the two brothers of Governor Garcia.
Yes.
Medyo ano sa akin yan eh. May relation yan eh. Kahit hindi nating aminin, it's secondary to COVID. But the fact remains that science of related COVID, may impact yan.
For sure. Psychologically, you mean.
In America. Ang ibig sabihin, and then people who are in higher places in society, matatakot ka kasi narinig ko nag-speech si Governor Gwendolyn 5 million and 3 million ng expenses eh. Imagine mo, napakayaman na pamilya. And paano yan kung mahirap ka pa lang? Kaya magdadalawang isip ka eh. So what I'm trying to say, Gigi, ang experiences can actually give us painful lessons eh. And gobernador yun eh. Ngayon, pag-implement niya ngayon, is a different issue ngayon. Kasi you're actually reeling from a problem na hopefully you can apply in the future. Nag-iingat ka. So, isa sa akin yan sa napaka-importante. And kahit, let's say, hindi natin aminin na silent tayo dahil, of course, we sympathize with Governor Garcia. I think the Cebuanos would learn. Ako, hindi tayo pwede magbiro dito. So, yun ang isa sa nakikita ko, one of the things na naka-apekto in terms of discipline ng Cebu.
So in terms of close at home, I guess the death of the brothers was close to the Cebuanos' hearts, right? So that's why it felt like it could happen to them. Although the television, especially international television, even local television, is not short of telling us stories about COVID-19 and how it can affect anybody. Doc, my question next, Doc, is this.
Let me answer that ng konti. Jiggy.
Yeah, go
kasi ahead. We tend to avoid answering those questions kasi nahihiya tayo eh. Tayo naman, we glean lang. Kasi these are personal things eh. Pero tinan mo ngayon sa United States. Apektado si Trump. Kahit we don't want to, feast on the miseries of people who are defiant, no? Pero hindi mo maaalis yun eh. Tayo, dahil tayo Pilipino, may paggalang tayo. But we feel, I think, nag-change tayo for the better. And ako, I feel for Governor Garcia, dahil mabait siya, nakilala ko siya in the past and here. And we hope na we can move forward from this particular debacle. Masakit sa akin dahil kaibigan ko rin si yung brother niya si Winston. Meron kaming UST siya before. Yeah, kaya masakit ng konti. Sa akin, we learned from that particular debacle and then move on. And then as a whole province and city, I think Cebu is a model right now. Hindi na nagsa-search since then. Diba? Yun ang isa sa importanteng lessons na natutunan ko dyan. I have personal knowledge about it. I am proud na I was able to add value during that time.
So, Doc, what does this mean for the entire Philippines? You said that Cebu can be a model of how to slow down COVID-19. But in terms of the entire country, Doc, is this success here in Cebu significant for our for the COVID-19? Will this have any effect?
Mahihirapan tayo ng konti. For the first time, na-overtake ng Calabarzon ng the whole NCR. And I think because of the to and fro process, yung provincial buses nag-open. So ngayon, magka-flock ang mga visitors from the provinces to Manila. And then uwi Manila to the provinces. And then ganyan din ang experience sa Western Visayas, sa Iloilo, sa Negros, yung locally stranded individuals. So ang learning nito, Jiggy, is that
Okay.
you should be strict in the border control. Kaya tayo hindi makakontrol like Indonesia. Aside from our template na hindi na napufulfill kada isang LGU, ang akin, Jiggy, is the border control. Kasi ngayon, may mixed signal eh. I'm sorry to mention this but let's say Secretary Roque went to Boracay last weekend. And then sinasabi, punta tayo sa Boracay. Ako nag-iisip pa akong pumunta sa hospital, Boracay kagad eh. So you send mixed messages to the Filipino. The Department of Health will say, stay home ka. While the other cabinet member, no, you mag-vacation ka. And you're on the brink or on the verge of flattening the curve. Ano ba talaga yung mensahe? And then, that's an island na supposedly magta-travel ka. Baka mag-spread from the NCR again to the Western Visayas. So, ayokong mangyari yan kasi we have some hot areas in other parts of the Philippines. Kaya hindi natin makorek. Pag nakorek mo isang area, mabuti na lang self-sustaining ang Cebu. Na-maintain nyo yan as an independent, as an
Doc?
Hi.
Okay. So
Sige.
my question now, Doc, is um, aside from Cebu, the island of Cebu, what other parts of the Philippines have managed to flatten the curve? And will we be able to do it in the entire country? Is that possible?
Dati ang Quezon City may problema dyan. But ngayon ang Quezon City has become a role model right now in National Capital Region. We're down less than 200 lang. So, ang laki-laki niyan. So, for the last 4 weeks, pababa na ang NCR na botas in National Capital Region. Ibig sabihin, merong mga bright spots na nakikita. Cavite is another area. So, there are bright spots eh. And then, meron kang Valenzuela. Ang nakikita ko is leadership driven. Ibig sabihin kung magaling yung leader mo, 'di ba? Ibig sabihin may kasabihan, the rate of the pack depends upon the rate of speed of the leader. Ibig sabihin kung mabilis tumakbo yung mga kabayo mo, kung sino nagdadala sa iyo. And I think it's leadership driven eh. So, yun ang aking nakikita, Jiggy. Kaya ganun yun. Now, kung ma-apply natin nationally, kung let's say ang buong IATF, ganun ang perception, then we can actually correct that. Kaya lang, ang hirap sa atin, there archipelago eh. Ang hirap eh. Yung biyahe, magko-cross border ka, like say NCR, 17 LGUs yan eh. Ang problema mo sa LGU, papasok ka let's say from Quezon City, papasok ka Makati, border ka. And then, nagkaroon ka ng public transport fiasco dati na babawasan yung social distancing na less than 1 meter, gagawin 0.75, 0.5, and 0.3. Hello? And then suddenly, nagbukas ang Manila Bay on a Saturday and the next day, 1,000 people went there. Nako, mag-i-expect ka pa ng surge niyan. Ang ibig sabihin, ang hirap, Jiggy. ng ganitong situation eh, di ba? So nakikita natin right now, merong mga mixed messages and measures na ginagawa ang leaders natin na hindi consistent to the playbook, na nalilito ang mga tao. Buti na lang, ang civil society medyo natututo na whatever the leaders will say, nag-i-stay ka pa rin doon sa playbook.
I guess it's a careful balance between the health of the economy and the health of the people, right? I know you have a very strong stand about that. So maybe you can.
Ngayon hindi na, Jiggy.
Okay.
Ngayon hindi na. Because of the high unemployment rate,
Okay.
wala na rin magagawa mag-lockdown ka eh. Kasi the lockdown is important when kukonti lang ang population mo. But let's say, nag-barge na tayo sa top 20.
Okay.
Pag, locking down will not help us anymore. It was important during the time na kukonti tayo kasi manageable pa.
Mm-hmm.
But locking down areas ngayon, I don't think it will help eh. Ang dapat natin gawin ngayon is i-discipline ng tao and then the measures nila and then i-build up ang healthcare capacity. Yan ang aking tingin at this point in time. But never mo sasabihin na magbakasyon or reopen aggressively and then you going to relax on the public health protocol. Eh, kasi it's counterintuitive eh. Nangyari to some eh. Okay, okay naman tayo mag-reopen the economy but do not actually relax on the health protocols. Yun ang nangyari 2 weeks ago, yung public transport. And now itong Boracay. So, comment ko lang naman yan because ang hirap nang i-convince ang mga tao right now to stay home eh. And then here we are engaging people to travel. LSI yun eh. And we know that LSI is one source of kalat, diba? Of spread and surge in other areas, particularly in an archipelago setting.
Look, I know you've had this discussion many times over, but I want this is something that deserves repeating. We are 20th in the world, if I'm not mistaken, as far as COVID-19 incidence is concerned, right? And I think we're number 1 in Southeast Asia. Can you put this in perspective for us, Doc? Is this about the population of a nation that is relative or related to the number of COVID-19 cases? Is it the economy of the nation? The poorer the nation, the more COVID-19 is. What are the mechanics and what are the rules?
It's not. Basically, it is not due to whether poor or hindi because ang number 1 US.
Okay.
The richest country in the world, the most powerful. And number 2 mo, one of the most populated and one, siguro, poor din siya, India. And number 3 is Brazil.
Mm-hmm.
Pero, according to the readings, leadership-driven eh. Kasi, ang nasa top 10 yan, US, Trump ang leader, and then Brazil, Jair Bolsonaro, and then number 13, si Boris Johnson. Sila yung mga leaders na defiant sila, hindi sila naniniwala sa mask, cavalier attitude sila, kaya nadali sila. Yan yung mga explanation. Kasi maraming mahirap din, maraming mayaman. Bakit? Bakit nandyan sila ngayon? Ang yayaman nun, London and all. So is it about education? Is it about money and power? Hindi. All of this meron sila eh. Ang problema mo dyan is the leader. And ang successful countries, nung binabasa ko yan, there are 3 things but sila okay. Number 1 is the leadership. Number 2 is governance. And number 3 is execution of the programs. So, nangyari yan, successful ang New Zealand, successful ang Vietnam, South Korea, and other countries because they follow the playbook plus strong leadership. Kaya kahit anong gawin ng ibang countries, magse-search. Like Canada. Ang Canada wala sa top 20. Inaral ko yan eh. Si Justin Trudeau, stickler yan to health protocol. In fact, gumawa pa ng video yan eh. Ang ganda ng video ng Canada. And siya pa yung nandun sa video. And then piniplay yan sa commercial everyday ng Canadian citizens. Saan ka pa hahanap doon? So, that's what I'm saying, Jiggy. It's about leadership and governance eh. And syempre, kung gano'n ang leader mo, susuportahan ka ng nation mo kasi you're very compliant eh. So, yun ang isang secret nun. The density, maybe, Pero sabi ko nga sa'yo, ang Toronto, okay lang siya eh. Ang Seoul, okay lang siya eh. So it's about leadership pa rin. So kahit kokonti ka, pwede ka pa rin ma-hurt. Ang daming countries na kokonti pero na-hurt pa rin sila. So sa akin, overall, it's about leadership, execution, healthcare capacity, and then motivating the people to follow. Ang importante dyan yung tao. That's why in Quezon City, we created this multi-sectoral organization ng professionals. Gusto na namin tapusin in 3 months yung i-flatten ng curve ng Quezon City, tulungan yung government. And then hopefully this will be a blueprint for other LGUs to follow. That's why we're helping them, engaging them, and trying to help the government. Hirap na eh. I don't think the government can do it alone. And I think the civil society should step up to the plate right now.
Doc, I think everybody has COVID-19 fatigue, right? I mean, we have been talking about this for 9 months now. And, this is really getting, very stressful and very boring. And people are sick and tired of listening and talking about it, but still the virus persists. Doc, what do you advise? How do you explain this to everyone? How, when in fact they have COVID-19 fatigue, but still we have to be vigilant. If the Philippines were a patient, Doc, how would you explain to us how to react to something that's been going on for the past almost 9 months now?
Well, Jiggy, ako din. Nagkakaroon na rin ako ng compassion fatigue, and nagkakaroon na rin ako ng COVID fatigue eh. And then after 5 minutes, siguro I felt this about 2 months ago.
Mm-hmm.
Ibig sabihin, bakit ba ako bumabangon sa umaga? That's a famous commercial ng kape. Ay, pag hindi ako kumilos right now, and I'm a person of influence, and I will give up. Kawawa naman yung mga anak ko. I have 2 doctors and 1 public official. Habang buhay, gano'n na lang, nakakulong ka na lang. And then, may experience ka on how to do it. So, instead na malungkot ako, and I organize a civil society organization. Kasi wala mangyayari. Paano tayo? We're all doomed right now kung susuko tayong lahat. And hopefully, you will provide another spark and re-energize the Philippines once again. Kasi pag nawala yung spark, wala na tayo. We're doomed right now. Kung nag-bar seat para tayo sa top 20, naghahangad pa nga tayo ma-flatten ng curve. Ang hirap naman nun. So ako personally, I want really to go over that one more time. Kaso lang kasi open-ended eh. Walang deadline na binibigay ang gobyerno when you want to flatten the curve. Kung siguro lahat sasabihin natin, we want to flatten the curve by December, before Christmas Day. So it's a call to action that all people will move on one direction to flatten the curve by December. Kasi walang deadline na nilalagpas eh. Parang, di ba dapat may call, meron kang hashtag December 25, 2020, COVID-free. Parang ganyan eh. Dapat merong call to action eh. Tapos one more push and that's it. Yun ang ibig ko sabihin. Ngayon, ang move ng NTF, kung nabasa mo, Jiggy, yesterday, nag-reorganize sila. May strategic plan meeting sila, I think sa Baguio. And they're looking at the first quarter pa to extend whatever they're doing. So, ibig sabihin, they're not expecting to flatten the curve by December. They expect to flatten the curve by the first quarter, given the trending. And of course, yung dating ng bakuna will actually coincide with the end of the first quarter. Kasi dadating yung bakuna first quarter or second quarter of next year. So that's why they extended their plan na they will focus on workplace and on community. If you Google that, you will see National Task Force, I think si Secretary Galvez mentioned that they will focus on the workplace. Which tama naman kasi doon pupunta ngayon ang mga tao and also in the community. So ini-extend nila. Pero ako, if I will have one big push this coming December, hindi na tayo mahihirapan sa first quarter natin. And then maganda yung transition natin towards the arrival of the vaccine sometime in the second quarter of 2021.
So, Doc, the conversation about vaccines is politically charged in the United States. There's an election looming, and Trump wants the vaccine to be there before the elections. But you mentioned the second quarter of 2021. Uh, what really is the uh, correct timeline for the vaccine? When is the vaccine going to be available for everyone in the world? And when can the Philippines get it? Yun ba? Second quarter of next year, that's how you feel we'll get it. And where will we get it from? Are we going to get it from China, from Russia, from the United States? Who is our source of the vaccine?
Well, well, doon sa history natin, I think ang Sanofi, meron nagka-problema sa phase 3 nila. And then Moderna, ganun din. I think on track pa rin ang Pfizer and the other companies like Astra. Kaya ang Australia, 3 days ago, nag-announce sila that they will actually sponsor all the vaccination program in Australia, care of ang kukuha nila yung Astra.
When?
Ang Pfizer nagsabi din, next year. I think...
next year pa. So not this year.
Not this year.
So nobody is getting any vaccine this year anywhere in the world?
None. Though, ang prospects sa Pfizer, they might actually finish their trial by November or December. Pero based on registration ng FDA, January pa yon eh. Mga 3 batch yun, Jiggy. So, at best, second quarter, realistically, sinabi ni Dr. Jimmy Montoy ng DOST, kasi siya ang responsible for na trials dito. Sure na yung June of next year. Kasi yung trials kasi sa states, pagka binena sila, they can terminate the trial na and do not wait to finish the study. Pagka merong sizable patient population na at nakita na safe yun, pwede nila i-terminate yun and then isasabit na lang nila to follow. Basta't kasi ang minimum lang naman yan 3,000 to 5,000 eh. They expanded it to 40,000 lang para marami sila kagad na pasyente. That's a strategy. Dinamihan nila, in-enroll nila so that they can get more patients. Pagka nag-improve ang efficacy and then also the safety, they can apply right away to the FDA. I think that's a strategy na I would agree with. And realistically, should it be coming from Russia or China? Wala silang track record of vaccination in the past. Hindi sila yung mga companies na nagde-depend ng Philippines for vaccine. First time sila, if ever, na they will actually donate or perhaps do clinical trials in the Philippines, particularly Russia. So I don't bet on that kasi wala akong experience with that. When you're a physician, you bet on medications na proven mo na effective sa pasyente. Siyempre, marami akong naging pasyente. Binigyan mo nitong gamot. Kasi for hypertension, hindi mo mababa ang BP. So sa tagal mo naging doktor.
There were pronouncements from the Kremlin that they already had a vaccine a few months ago. What happened to that?
Siyempre, alam mo naman ang pharma parang politika rin yan eh. The first to announce akala mo first to launch
Like landing on the moon, right? It's similar to that. So what happened to that when Putin said that they already have a vaccine? Was that true or was just
diba, the news before October 1 daw they will start on the trial. Hanggang ngayon wala pa yung trial eh. They would start daw PGAs, RITM and Manila Doctors. Ano na ngayon? October 6.
Mm-hmm.
Wala pa rin yung trial. So ibig sabihin wala pa.
Doc,
again, based on the track record.
Are we overestimating? Are we hyping a vaccine too much? I mean, if and when we do have a good vaccine that's safe and works, does that mean that COVID-19 is completely and totally eradicated from the face of the earth? Is that what it means when there's a vaccine already?
It's not. I'd like to clarify that. Even si Dr. Anthony Fauci states, the vaccine is not a silver bullet na it will eradicate vaccine from the face of the earth. Hindi po. Swerte nga tayo kung maka 70% effective mo yung produktong yan eh. And then you need about multiple approaches in order to get the vaccine. Kunyari, if I were a leader in this country, order ako sa marami. Kasi because many countries will compete for the supply eh. So, I will actually engage Pfizer, I will engage Astra, I will engage the other Moderna, o may Russian ka, may China ka. So that the whole population will be served. And then, habang dinidiscuss siguro yung budget ngayon, meron ka ng criteria, sino yung babakunahan mo? How many are elderly? Anong definition mo? Sinong bibigyan mo? What population? What particular regions? Dapat klaro na yan. Hindi pagdating ng bakuna, unahan tayo dyan, magkakagulo yan. Ngayon, kung klaro yon, na-prepare mo yon, na-prepare din ng mga Pilipino, magiging okay yon. That's what I'm saying right now. So the vaccine should not actually be a silver bullet. Ako, I think, magro-roll tayo ng mga 2 taon jigi dito. And then we will have herd immunity. Pagka meron na tayo mga 60 to 70% ng population na injectionan, the 30% will be covered by herd immunity.
So you do not think that a vaccine is a silver bullet, and
No.
in fact, the virus will still persist. In fact, we still have a lot of diseases that plague the world, right? That have vaccines.
Polio,
that have
measles,
vaccines, yeah. So it's still
pneumonia.
there.
Kahit libre ang pneumonia sa atin, ang dami. Sa States nga, nagkaka-flu pa rin sila every November, eh, di ba? So, kasi marami kasing marami tayong mga variations ng mga genetic types na lumalabas eh. Marami tayong mga ganun. Marami tayong problems din sa immune system. Kaya kita mo yung mga pandemic natin, puro virus eh. SARS, H1N1, avian flu, puro virus yan eh.
Doc, I know that one of your advocacies is affordable health care, right? In fact, that's how I knew about you, because I think you feel strongly about affordable health care for everyone. Doc, we have so many healthcare issues now that are sprouting in the background of a pandemic. You know, we have the PhilHealth controversy. Now we have all these billions of pesos worth of medicines that have expired or are about to expire. What is going on, Doc? And why, of all times, why now? Was this really because of the pandemic, or this was already been happening even with or without a pandemic?
Ano na yan, Jiggy eh. I was reviewing it, 3 decades na yan or 4 decades na. When you mean kasi investment in healthcare, there are 3 important factors. Una, human resources. We're the #1 exporter of doctors and nurses abroad. Parang paper mill lang tayo, graduating in the best schools. One of the best schools in the world eh. Ang dami tayo. Even Cebu, daming schools eh. After ng mga 2 years yan, aalis ang mga nurses natin. They will go to London, to US, to Singapore, na ang bayad 5 times to 10 times sa atin. So, nawawalan tayong human resources. Number 2, our processes pangit. Wala tayong foresight, PhilHealth. In the midst of pandemic, nalugi. Nagkaroon ng corruption. Imagine mo yun. In the midst of pandemic, ang PhilHealth is an important tool para pag na-confine ka, may case rate ka, hindi na iisipin ni Juan de la Cruz kung saan siya kukuha ng pera.
Correct, yeah.
Pero na-abuse. The money was given to centers na wala halos COVID pa. And pati maternity clinics and dialysis centers capitalize on it. Imaginein mo yun. And then number 3, we did not invest on infrastructure. Ang ibig sabihin, at that time nang nag-COVID tayo, isa lang ang testing center natin, RITM. RITM lang, imagine mo 2,000 kits lang tayo noon. Eh samantalang ang Vietnam 600 testing sites. So, ang ibig ko sabihin, kung nag-invest tayo sa mga laboratory, research labs, and hospitals, hindi tayo magkakaganito. Ang ibig ko sabihin, hindi tayo nakapag-invest. Other countries nakapag-invest on healthcare eh. So, if we think that health is the greatest equalizer, dapat yan ang pera, dyan tayo maglalagay ng pera eh. But apparently, we're focused more on tourism rather than health eh. The budget on tourism, mas malaki pa sa health eh. In fact, it's number 5. Akala natin magiging number 1 pa nga yung health investment eh. Apparently, hindi nangyari siya eh.
So you mean to say this pandemic did not change the way we look at healthcare. I know that we're talking about the healthcare problem here in the Philippines after the fact that there's already a pandemic. But the fact of the matter is that something like a pandemic can hit a nation like the Philippines, and we are not ready for it. Didn't this change the way we look at healthcare now that we have experienced a pandemic? And do you think, Doc, that we have learned our lesson or lessons, and we will invest more on healthcare now after this pandemic?
Alam mo, Jiggy, ito sabihin ko na sa'yo. I think kaya tayo nagpe-fail at wala tayong nadiderive na inspiration. Kasi after too many Senate hearings, the senators were asking for the head of the Secretary of Health. Even sa PhilHealth, nagkaroon. Imagine mo, the chairman of the board, hindi niya alam na they were actually disbursing billions of pesos there without him being aware of that. And then, siyempre, ngayon, nabalita mo na naman, nabubulok 2.2 billion na gamot ng COA. Pero wala nang galit Kasi alam natin walang accountable Para bang on paper, ganun lang. So, when people fail to demand accountability sa tao, you erode the credibility. And then, pag nakita mo nagsasalita, you don't believe it anymore. So, you're not motivated right now to change because wala namang mangyayari. Ganun pa rin yan the next day. So, what I'm trying to say, Jiggy, again, it boils down to leadership and demanding accountability. Dati I used to believe that sana you change sources in midstream diba? But there's no stream anymore to talk about Dati ng line ko dati you change sources in midstream. Kasi nahihiya ako. Hindi na ako nahihiya. Kawawa naman ng bansang Pilipino if we will not realize that there's a failure of leadership in the Department of Health and PhilHealth. If we don't realize that, then we're part of the problem.
So I guess this is part of COVID-19 fatigue. We're also sick and tired of all of these things going on, and nothing is being done, right?
Wala kang nakita, Jiggy.
There's no more outrage. There's no more outrage now from the Filipino people, right?
Yeah. Wala na. Walang outrage, Jiggy. And in this country kasi, kaya nanalo si President Duterte at that time. Because social media demanded for change. Remember, kaya he was catapulted to power because of the promise of change. I can correct the drug problem in 6 months. Diba? Mga ganong klase.
Mm-hmm.
So people were captivated by that kind of promise from a president na hindi natin nakikita for a long time. Unorthodox, hindi let's say the usual educated na English speaking and all, hindi magsasalita ng ganito, ganyan. So we were excited. But the time na kailangan natin yung tapang na yun, di natin nakikita yung bangis And then hindi mo nakikita yung accountability. So people, I think, napapagod na rin to listen. So sana magkaroon ng change, pero I don't see any change Kaya nagkaroon ng fatigue ang mga tao because they don't see any silver lining anymore in terms of leadership. If this is the kind of leadership in the health department nakikita natin, gumagano ng tao wala na.
Mm-hmm.
Gumagano na. So I think yun ang isa dun You've experienced that na parang ganun lang. Wala nang galit 2 billion. Nobody raised hell. Wala. Diba?
But if he's not doing a good job, how do you explain his very high approval ratings?
No, hindi, not the president.
Okay.
And then I don't think then the ratings of the president dapat gawin during the pandemic.
Mm-hmm.
Because the pandemic, the presidency, maaaring likable siya. But the pandemic is actually a result of the leadership in the health department.
Okay.
And I don't think also that's a wise move to do a rating when actually number 20 ka. So parang, why do you need a rating for? Ba't mo kailangan ng rating? Di naman rara for president si President Duterte.
Mm-hmm.
I mean, why do you have to affirm na gusto siya ng tao? He's the president until 2022. So why do you have to affirm na likable siya ng tao?
So when you say it's a failure of leadership, Doc, who are you referring to? Are you referring to the health secretary? Are you referring to a specific person, or it's just the government in general?
No, it's the health driven to eh. Kasi imaginein mo, ang head ng IATF, Health Secretary. Ang chairman of the board ng PhilHealth, Health Secretary. Ang head ng DOH din. How come you have three important agencies under your belt tapos lahat nagfe-fail? I mean, mag-iisip ka siguro, Mr. President, pwede bang IATF na ako? Huwag na muna ako PhilHealth. Or sa DOH, perhaps OIC muna, si Yusek Bong Vega muna so that I can focus on the IATF. I mean, dapat may ganung klase kang thinking process if you really love the Filipino people. I mean, ako, if I love the Filipino people, di ko na kaya, then I call it quits. Or kung talagang gusto nyo ako, Mr. President, but, you know, all hands on deck eh. My hands there and even my 2 feet nandun na sa table eh. Hindi ko na kaya yan. So you need right now somebody to help you out kung talaga malaki ang trust sa'yo. Because you cannot function as IATF. How many cabinet members are there with you? Agencies. Meeting yan, 12 hours inaabot. When I was there at NTF, nakikinig ako ng meeting yan. And then, who's in charge of the Department of Health? Who's in charge, I say, of the PhilHealth? So what I'm trying to say right now is that kailangan meron kang redirection of goals eh. Hindi pa naman huli ang lahat eh. We have about less than 2 years. We have 1 year and 9 months to correct this problem. Eh kung iniisip natin ang COVID will last until 2 years, perhaps we should start right now in terms of analyzing ang leadership requirements natin. Kasi ako talaga I can feel the people right now talagang depressed eh. Kasi imagine mo you're going to Christmas, wala ka man lang pang medianoche, di ba? Eh 9 months na, ang daming jobless. Yun ang lang iniisip ko. Kaya hindi tayo tumitigil sa advocacy natin. Kaya kita mo ang comment ko ngayon is different from the comments last time. The gloves are off. Ang ibig sabihin, and people say, baka gusto mo lang yung position. No, I have a good life. Nasabihin ko na sa iyo here on your radio. I don't want any vertical or upward direction sa life ko. I'm happy where I am right now. The reason why I'm doing this because I see no future for my family in the next 2 or 3 years kung hindi masosolve yung COVID crisis natin. We will never be back to where we were before kung hindi tayo lahat ngayon tutulong.
But Doc, your advocacy of the healthcare reform was already there even before COVID-19, right? Now that COVID-19 is upon us and it's been here for the past 9 months, I think it has changed the way we look at healthcare. Do you feel that we will invest more on healthcare, that the government will invest more on healthcare now? Maybe not right now because we're still trying to fix COVID-19. But in terms of the infrastructure, in terms of the investment, you said fifth lang yung healthcare natin in terms of priority.
Budget.
Is it going to move up to number 1 soon
No.
because of COVID-19? What do you think is going to happen? What's the best case scenario for you?
The best case scenario is that we're going to choose the right leader in 2022. Dapat may vision yung leader na yon on the things that matter. And to me, dalawang nagmamatter eh, health and education. Kasi yan ang human capital eh. If you have a healthy and educated population, you have a fighting chance for a job. Tinan mo, kahit malusog ka, hindi ka nakapag-aral, you will land on an odd job. Educated ka pero may tuberculosis ka, you will not be, admitted to a good job dahil may sakit ka. Kasi ang clearance mo will be hinged on 2 things eh. Hahanapan ka ng medical certificate and a transcript of record. Equals job. Pag wala kang health at education nang wala. Pag wala kang education, health nang wala. Job. So, human capital yun. Yun ang ginawa ng Singapore. Ginawa nila, inalagaan nila mga tao nila, nalagaan nila, pinaaral nila, pupunta ng UK, Singapore. Ang ganda ng job nila. Ganon din ng China, ganon din ng Korea. Tayo, we never invested in an education. That's why kahapon, narinig natin, yung modules, kailangan pa ng internet connectivity. Di ba? So what I'm saying, kung sana naisip natin to. Though hindi fault yan ng DepEd kasi ngayon lang sila niyan eh. Ang investment niyan, decades ago pa, hindi ngayon. But we have to start somewhere na ang leader natin to 2022 will champion health and education equals job. That's the human capital thing. Pag walang nakaisip niyan, balik ulit tayo to square one.
Issue in the 2020 presidential elections, because I know for a fact that Barack Obama, so Obamacare was one of the biggest political issues back during his time. Do you feel that the healthcare reform or healthcare will be the top political issue during the presidential election come 2021?
I think so. Healthcare yan. It should be a political issue. Kailangan i-discuss yan. Kasi nakita mo naman, Jiggy, ang daming doktor na namatay, ang daming nurses na walang work. Hanggang ngayon, sinasabi natin tataasan ng sweldo. Pero dahil pa rin nagre-reklamo eh. Tsaka imaginein mo, ang daming nurses na gustong umalis in the midst of crisis para lang kumita ng pera. But hindi mo naman din sila masisisi because there's a greener pasture out there na hindi nila nakikita here. Diba? In their backyard. And yet, ayaw natin sila paalisin and hostage that they are needed here. Pero hindi mo naman sinasweldohan ng tama. So are we fair? I don't think we're fair about it.
Doc, I don't know, but it seems to me that you're painting a very gloomy picture. With all of these healthcare problems that we have with PhilHealth and all those billions of pesos of medicine that nabubulok, sabi mo, and then of course we have this pandemic. What's the silver lining, Doc?
Well, ganun lang naman yun. Ang tawag dyan, Jig, is catharsis.
Okay.
You have to reflect muna on the bad and then think about the best. Kasi ganun lagi yan eh. Lahat naman ng tao after a death of a loved one, bago tayo maka-bounce back, it will take a while, di ba?
Mm-hmm.
And I think we're in a catharsis mood right now eh. Kaya tayo malulungkot eh. Nagre-reflect tayo. And ang nakikita ko, we'll actually have a silver lining. Once na-touch natin ng 1,000 cases, I think we're gonna hit it. And then that will energize the Filipino once more. That's why, pag nagpo-post nga ako ngayon, I'm just not saying na ito, sinasabi ko, I think we're going down, ganyan-ganyan. Which kina-capture na maraming mga netizens eh. Kasi may nag-a-analyze ng data and giving hope eh. Ako, tingin ko, once we hit the 1,000, I think ma-energize ulit yung mga tao, babalik yun eh. So ngayon,
what do you mean? Explain to me, what do you mean by 1,000, Doc?
1,000 cases per day.
Okay.
Kasi dati nanggaling tayo, GG, 7,000, 6,000,
Okay.
5,000, 4,000. We're down to 2,500 a day.
Mm-hmm.
For the last 7 days. I think pag nag-hit tayo ng 1,000.
Or less.
More or less. I'm calculating siguro by November 2,000 and then December 1,000 and then 500. I think we're okay. Kailangan may nakikita kang score eh, na ganun eh. Just like watching a basketball game, nakikita mong tambak ka. Pero kung na-chip off mo yung lead, na-inspire ka, let's say from a double-digit lead, and then suddenly 1 digit, and then, may chance pala of winning eh. Parang ganun na nakikita ko dito. So we have to keep on chipping off that particular number of cases eh. And that will only be the time that we will say, tinan mo, magja-jump na, magkakaroon ng bandwagon effect yan. Na everybody will jump in and then really they want to crash the curve. Yun ang nakikita ko niyan.
You know what, ladies and gentlemen, COVID-19 has been around for months now, and I know we're all suffering from COVID-19 fatigue. But the problem is COVID-19 is not fatigued at all. In fact, it is still there lurking. It is still there spreading. So if and when we blink, if and when we low down our guards, I think that's when COVID-19 will attack again and perhaps create a second wave. So I think we need to be vigilant all the time. We need to know that the virus, although it's already been controlled, can still come back with a vengeance.
Correct.
Doc Tony Leachon, thank you so much for doing it is whatever it is that you do out there, battling it out in spite of the fact that you have, like you said, compassion fatigue, COVID-19 fatigue. Doc, where can they find you on Twitterverse, on Facebook, and all that? Because I'm sure a lot of people would like to know your thoughts about this whole thing.
Well, I'm on several platforms. I have Instagram, I have 3 Facebook account, I have a Twitter account, I have a Gmail, anthony.leato@gmail.com. You can find me anywhere. And si Jiggy alam na kung hanapin eh.
Yes, of course.
Ang final message ko
Go
lang
ahead,
is
Doc.
that
What's your final message?
my final message is that I think we need to be resilient and adaptive. Maybe meron tayong dark cloud right now, but behind the dark cloud is always a ray of hope. May sunshine lagi dun eh. And after the rain, there's always a rainbow. And at the end of the rainbow, may pot of gold. So ganun lang lagi yon. I think lilipas din to. But we had to fight back. We had to demand accountability in a respectful manner without being political about it. Ano lang, walang bad words, walang ganun. It's just, kasi if you will not make noise, you will not be heard. Yan ang aking dati nang tahimik ako eh. Pag hindi ka nag-ingay, sino makikinig sa'yo? But you have to be respectful so that you'll be credible. Hindi ka gripey and ranting lang without evidence. And I think that is very effective. Ngayon, kung tatahimik na lang kayo at lahat tayo napapagod, walang mangyayari to sa atin. You think about your family na hindi na makakabalik. I think always of my kids right now. Ako, pabalik na ako eh. Nag-celebrate na ako ng 60, but I hope to live up to 90 para makita ko yung mga apo ko. But I'm thinking daily of my kids right now. Nakakatapos na ng pagdodoktor, nag-pass ng board. In their 30s and mid-20s. Paano na sila? The generation of the new Filipinos, dapat sila yun eh. Resilient, adaptive, brilliant. Yeah. Kaya I'm doing this because of the talents given by God in terms of a lot of things. Education, influence. Sayang naman. Now, if we will actually consolidate our efforts right now, like si Jiggy, hindi ko naman to kilala to si Jiggy, tawag lang ng tawag to eh. Ang ibig sabihin, kung i-establish ko si Jiggy, this is an opportunity to serve eh. Malay mo, makahagip siya ng somebody that can actually inspire a lot of people. Ganun lang yun. Kaya, we should never stop making noise as long as you are respectful so that you will be heard. I know it's painful to some of the leaders na tatamaan natin. But the way it is eh. Pagka gusto natin ng leadership eh, then hindi tayo dapat onion skin about these things. And we should actually be inspired na pagka meron bumabati ko sa'yo, we step up to the plate and prove them wrong. Dapat ganun eh.
Doc, I don't know if you've been asked this question, and I'm sorry to put you on the spot on this question, but I've never seen or heard anybody ask you this question. But I'd love to ask this question right now tonight, Doc. You seem to be connecting with a lot of Filipinos. You seem to, your thoughts are being listened to by millions of Filipinos. Has running for a national position to move forward your advocacy of health care reform ever crossed your mind?
Well, when I was 53 years old, after my retirement from Pfizer, my brother, mayor siya ng Oriental Mindoro, asked me if I wanted to run for Congress kasi tatapusin yung third term. I did not. Kahit yung kalaban at that time, at tingin ko kaya ko. Hindi. So, ngayon, 7 years after, tinatanong ko same question. Siguro hindi. I'm good right now eh. Sa ginagawa ko ngayon eh. But, I don't know. Mahirap magsabi ng tapos eh. Pero, noon, I had a sure lane eh. Wala akong kalaban halos noon eh. E di sana ngayon on my third term. Baka nag-speaker of the house pa sana ako. 'Di ba? 'Di ba? In retrospect.
Yes.
'Di ba?
I'm sure they need a doctor out there, right?
Right. But ang ibig sabihin, hindi siguro yung path na yun sa akin. Ngayon, kung nyari tawagin ka later on, it's God's way of telling me kung anong pwede. I'll never say no right now. But if I will be summoned and there's a good chance of winning, sige. Pero sa ngayon, ang saya ng buhay ko eh. Nagre-retirement mode na nga ako eh. Kasi may dalawa na ako anak na doktor. Suddenly, bigla nagka-COVID. Bigla ka nabuhay ulit ito advocacy. Hindi ko nga iniisip eh. Tapos na ako dito. After turning 60, gusto ko na magbakasyon eh. And nag-COVID naman. Unbelievable. So, have faith. Hindi ko alam kung ano pwede mangyari sa buhay natin. But surely, I will not jump into the fray kung hindi ako ready. I'm happy where I am right now and happy dito sa ginagawa ko.
Senator Tony Leachon has a nice ring to it.
Tingnan natin, Jiggy. But I'm happy to serve anytime kahit walang posisyon. Hindi ako. I'm not a politician. Sana nun pa, sabi ko na sa brother ko.
Thank you so much, Doc. Thank you so much. It is always awesome to talk to you, and you're so generous with your time. I know you're tired and all that stuff. And you're, in spite of that, you're still here talking to the Cebuano, talking to me. Thank you so much, Doc Tony Leachon. It is always a pleasure to talk to you. Good night, sir.
Good night, Jiggy. Thanks.
Stay safe.